October brings awareness to breast cancer. Helping us shine a light on this is Dr. Hanberg with the University of Michigan Health Sparrow. Dr. Hanberg, what is the meaning behind 40 this year?
Well, 40 this year represents 40 years that we've had this initiative to do screening mammography. And 40 is also, a big number because that's when we recommend women start doing their annual screening mammograms. And then another reason why 40 is very important is that since we have started doing annual screening mammography, we have found a 40% decrease in mortality from breast cancer in women. So it's a huge impact that we've made from, encouraging women to do screening mammography at 40.
That's impressive, making a difference by just having this awareness. You bring up mammography, which is getting tested for breast cancer. What is the importance in getting tested and having that early detection?
It's really important to get the detection early because the sooner we find it, the outcomes are much better, the treatments are much less invasive and easier on the patients. So, they've found that when we find things on imaging alone that are not yet detectable clinically, meaning like you can feel it, it's palpable, if we can detect it before it becomes palpable, the outcomes are much better. And so that's why we recommend doing, those screening mammograms, because we can find things that are much smaller and easier to manage.
That's why it's important to get those tests, also starting at the age of 40. But even if you're not 40 years old yet, what are the signs and symptoms to look out for? You mentioned sometimes there can be a lump.
Yeah, definitely. Doing self-exams is a good thing. Knowing what your tissue feels like. If you feel anything out of out of normal, any lumps, things like that, talk to your doctor and they can order some diagnostic imaging even before 40, because unfortunately we do see some breast cancers that are diagnosed before the age of 40. So looking for lumps, lymph nodes in your armpit, things like that that feel enlarged. Breast pain is a common thing that people come in for. Thankfully, there's little to no association with breast cancer and breast pain, but that doesn't mean that it's not something that should be addressed. Go ahead and talk to your doctor about it, but thankfully that's not really a concerning symptom typically.
So if you have any concerns, if anything seems abnormal compared to your daily routines or how you normally would feel, go address that as soon as possible.
Exactly.
Coming up this week, the University of Michigan Health Sparrow is opening up its comprehensive breast center. How is this going to help even more patients?
Well, this is going to help people in several ways. It's going to basically double our capacity to see patients. So we're going to be able to do double the amount of mammograms, ultrasounds, and biopsies, so we can serve more patients. And it's also designed to be very efficient, the way that they can travel through the department and everything like that. So we should be able to get people in and out very efficiently, because that's the key. Is people that live busy lives. We want them to be able to get their imaging, get diagnosed as quickly as possible, and either move on with their lives or move on with treatment if they need it. So the capacity is a huge thing. It also brings a couple new technologies. We have new AI system that is part of the screening mammography, the screening mammograms that people get, and it helps us, detect cancers as well. It's kind of like having a second set of eyes on those images, so it makes that sensitivity a little bit better, and it kind of, can help flag things for us. In addition to that, a new technology called contrast enhanced mammography, which is like a traditional mammogram, but it adds contrast, like when you're getting a CT scan, and it helps kind of like light up that tissue that might be cancerous, and it helps remove the normal dense tissue that can make it very difficult to interpret screening mammograms, because dense tissue can oftentimes obscure breast cancer. So it can kind of remove that dense tissue and just leave behind things that might be concerning for breast cancer.
Wow. So helping people, not only doubling the capacity so you can get even more patients in, but the technology also evolving with the times to, again, help people improve and hopefully get rid of that breast cancer. Dr. Hanberg, thank you so much for joining us on Mid-Michigan Matters.
Absolutely. Thank you for having me.